the issues that matter. King 5 News up front.
We're back, and thank you once again for joining us today, and thanks to the healthcare reform panel we've assembled here again. And Dr. Stark, let's start with you again, and let's talk solutions. We've heard lots of opinions out there about what should be done and how we can do it. What I'm curious about is what is politically realistic to do in terms of healthcare reform in this country.
Well, I'm not sure what exactly is politically doable. But certainly, if you look at what the solutions would be, 87% of our health care in this country is paid for by someone else, whether it's the employer or whether it's the state or the federal government. What we need to do is give control of those health care dollars back to the patient and allow him to use those dollars and make his own health care decisions. And the way to do that, one of the simple ways to do that, is to allow individuals to take a tax deduction just as employers are able to do now. There are a list of other things that could be done, but the important thing is to put the patient back in control.
And I'm just curious, in the current environment, is that something that can actually be done, that it's realistic to assume we can figure out a mechanism to do that?
I think individuals, patients, people in this country want that. They demand that. We talked about cost being the number one problem in this country with health care, and I think people understand that and they want to control their own dollars.
All right, completely sensible there. Let's go to DJ Wilson. It seems like on the national level, at least, the single-payer concept, sort of nationalized health insurance right now, seems to be off the table. Why?
Well, I think those are both policy options that have been pretty beat up 15, 16 years ago, and there's broad consensus now for action, ranging from the automobile industry in Detroit to consumers at the bottom of the food chain, so to speak. And none of them are really saying, I need to have government do everything for me, or I need to have one provider do everything for me. People are saying, I want choice, but they're saying we have to do something. And so it's a question of whether it's incrementalism or something more comprehensive. But I think the interesting thing that's happening is you have broad consensus among stakeholders for financing reform. And what that means is rather than paying a provider, a hospital, or a physician when you go in for a service, regardless of the outcome, you should pay them on the quality of the outcome, so that you're not readmitted to a hospital 3 days later because you now have an infection from the hospital, when in that case the hospital would get paid twice. So that subtle shift outside of the single payer, outside of the national health insurance debate, is fundamentally important. If we can reform the way that we compensate providers, it changes the entire dynamic in healthcare.
Well, let's talk to Senator Kaiser, who's just been in Washington, D.C. for several days, talking healthcare with a number of people, including our congressional and Senate delegation. I'm curious, what do you expect the Obama health plan, when it sort of emerges, to look like? What shape is it going to be?
Well, it appears to me that there isn't going to be, per se, an Obama health care plan. What it appears that this will be a group of different leaders in Congress, in both the Senate and the House, putting their imprint and their thoughts and their ideas together in a legislative approach to health care reform that the Obama administration will participate in, but will not present as a plan out of the White House per se. And that's really different than what happened in the Clinton years, and I think intentionally so, considering what happened with the Clinton plan. So they're not going down that road again. They're going down a road that involves the House and the Senate and the legislative process. It's quite a process, you know. We use it a lot in Olympia as well. And one of the things everyone told me when I was in was in D.C. the last few days, was that we will achieve health care reform this year. We will do it by the end of the year. The optimism, the level of intention was very high. They also warned that they didn't need to have the perfect be the enemy of the good, which is that if you hold out for the very best ideal utopian approach to health care reform, it will not succeed. What is on the table are practical solutions that will achieve our goals of coverage for everyone, that is affordable and of high quality.
All right, Dr. Rogers, with Code Blue, when you did your polling, what were the things that people said that they wanted to see in terms of health care that could be delivered to them? What are the key components people are expecting to see?
Well, accountability is one of them. Interestingly, accountability throughout the profession who are delivering the care is directly linked to affordability. For instance, in our state, we have a variance in C-section rate in hospitals that goes from 15% at the lowest to nearly 40%. at the highest. So citizens should have a little bit more expectation of consistency when they show up for care, and that will be directly related to affordability. They are also looking at equity, and they're also looking at choice of providers.
All right, a wide range of very complicated topics that make up this one topic, and we want to thank you for joining us. Dr. Stark, Dr. Rogers, Senator Kaiser, thank you very much. Also DJ Wilson, and thanks for the book. Very interesting information and suggestions for the governor in there. We continue this debate online. What do you think should be done about health care, and is the Obama administration on the right track? Just type in king5.com/upfront.